Now, 10th of October will be World Mental Health Day, and however, in Kenya, we're going to have those celebrations later on today, and it is important for us to talk about there being dignity in mental health. And to help us with that discussion, we have Dr. Mucheru Wang'ombe, who is joining Mutegi Njau on that conversation. Now, she is a psychiatrist, and she will be unpacking some of the critical matters as far as mental health is concerned. And if you have any questions and comments on the same, the SMS number is 22422. I'll tell you that number again, 22422. Talk to us and give us your views, your comments, and maybe even your suggestions of how we can better this conversation. For now, though, I hand over to Mutegi.
Good morning, Dr. Ari.
Good morning to you.
There is very interesting theme of the commemoration of tomorrow. And is it tomorrow or today? 9th.
Okay, it's tomorrow.
Tomorrow.
The World Mental Health Day, worldwide, is celebrated on 10th of October. But our nation is celebrating it today. That is 9th of October at Moi Teaching and Referral Hospital.
So the theme is dignity in mental health. Is there any dignity in mental health or in ailment? Dignity means what?
Well, you should be treated with respect, and your human rights should be put into consideration even as you get treatment for mental health issues. There have been problems with human rights violations and stigma and discrimination against people suffering from mental illness, such that it has become shameful for me to say I'm suffering from anxiety, or I'm suffering from depression, or worse still, I'm suffering from schizophrenia. When you mention that, people tend to change their facial expression, and I mean, they even change topic. If you say you're a psychiatrist, they'll do the same.
If mental health, I don't know, you know, typically in Africa is you're mad.
Okay, that's the layman's term.
How do you have dignity if you're mad?
Let me put it this way. The layman's term for somebody who has lost touch with reality,
yes,
that is someone who is psychotic, either someone who is seeing things that other people don't see, that means they are hallucinating visually, or they're hearing voices of people who talk, but those people don't exist. Those people are branded as psychotic. They've lost touch with reality. The layman's term would be to refer to them as cheesy, mad, or something like that, which is very unfair. Because what you're doing, you're giving them a label. You're stigmatizing them. Somebody who's been admitted to Mathare Hospital before is referred to as ex-Mathare, just like the way you would say ex-convict. It's very unfair on them. So today, in Kenya, we are trying to raise public awareness so that people are not stigmatized, they are not discriminated against because they have mental illness.
Just like if you have cancer, are you called ex-cancer?
No.
Or if you have diabetes, ex-diabetes?
No.
So that's what you are trying to tell people?
Yes. That you should not call the person ex-Mathare, you shouldn't call them cheesy, you shouldn't call them, I mean, you shouldn't give them a label. They're human beings, treat them right.
But in society, are we ready for that?
Yes. In fact, we are more than ready. We should have done it yesterday, not today. We should have done it like yesterday.
Madmen or bad people, the ones in the streets, why are they there?
Okay. There are many reasons why people are on the streets. One being the fact that some of them are homeless. And when they are homeless, they tend to look unkempt. They tend to abuse substances. They'll sniff substances. They will take alcohol. They will smoke cannabis, which is referred to as bangi. They will take heroin. They will take cocaine. And they will end up being mentally unwell. So the reason why you find people on the streets is that, one, they're homeless. Two, they're abusing substances. Three, nobody has decided to help them get any help in terms of, for example, stop taking the substances and get rehabilitated. So like, for example, the rehabilitation of street families is a good move to move them out of the streets, and probably for those who need drug rehabilitation, they should be taken to drug rehab centers.
If those diseases you have described them psychotic or any mental ill health, are they covered by insurance companies?
Unfortunately, there are clauses, there are exemptions. In fact, if you attempt suicide, or if one attempts suicide today, definitely the insurance cover disengages themselves from your treatment. They say it is an exemption, yet it's a symptom of severe depression. People with severe depression tend to be very hopeless, helpless, they feel worthless, and they will attempt suicide. So that is one of the exclusions. The other exclusion is substance abuse related problems. Like if you're abusing alcohol, if the insurance company comes to know that there was alcohol taken, even on a social basis, they decline paying the bill for the patient. And of note is that we have a Mental Health Act. This is a law in this country, which came into place in 1989, and it protects the patients. It protects them against stigma and discrimination on the basis that they have mental illness. So what the insurance companies are doing is actually wrong. To discriminate the person because they have either attempted suicide or because at one time or other during their life they have used substances which include alcohol, cannabis, heroin, cocaine, cigarettes, etc., etc. So it is very wrong for the insurance companies to discriminate against patients on the basis of the fact that they have either attempted suicide or they have had the substance abuse problem.
I remember when AIDS came in this world, insurance companies used to discriminate against people who were positive or who had AIDS. Now it has changed. How did it change, and why can that same method be used to? Because you are saying mental health is like any mental disease like any other disease. Why can't we use the same method to ensure that insurance companies do not discriminate against people with mental problems?
We are advocating for that. One, we are trying to inform the public that it is your right to get treated, whether you have mental illness or any other illness. What do I mean by mental illness? It's an illness that affects the way you think, the way you behave, or the way you regulate your emotions. So you could have mental illness because either you have a primary psychiatric problem, like for example you have depression or anxiety, or you could have a tumor, you could have something growing in your head that then makes you start behaving abnormally. So the difference between the person with a head tumor and the one with depression or anxiety is the same. I mean, there is no difference, because the fact that they're presenting with abnormal behavior or they're having problems regulating their emotions or their thoughts does not mean the one with depression or anxiety should be discriminated against. And we are hoping that with the Mental Health Act, with the current advocacy that is going on, that we are going to put an end to this discrimination against mental illness, so that people will not be labeled as, like before, HIV, that's an exclusion, and now mental illness, that's an exclusion. We want to include mental illness in the medical covers that are there.
What you are saying is,
yes,
the mind,
yes,
is part of the body.
Sure, and it controls the
It is like when if your cut 100, then the insurance will pay for your heart, but they cannot pay if you chopped your head and then you become mad because somebody hit you with a rungu, then you became mad. They should pay for that also.
They ideally pay if there was no suicidal attempt or if there was no history of substance abuse. But should there be any of those two, they quickly decline paying the bill and the patient is on their own. So it is one of the things that we should advocate for, even as citizens, as government employees, we should actually advocate for the fact that people should be covered for mental illness as a whole, regardless of whether there is an underlying substance abuse problem or not. And it's important to say that there is something called comorbidity.
What is that?
Most people with substance abuse problems have a primary mental illness. Like, you might find a teenager starting to use alcohol to self-medicate. They are feeling low, they're suffering from low self-esteem. So what do? They start using alcohol on a social basis. Then they get dependent on the alcohol. So then, if, like for example, the depression was treated, then this person would have no business abusing the alcohol. The same with something like cannabis. Somebody may be hearing voices, and it's just the onset of schizophrenia. Then they take cannabis, and cannabis now triggers off the onset of schizophrenia. So if then it is said to be a substance-induced psychosis, then the insurance quickly pulls out.
There is some sister from, Sister Nixon from Nixon Dugire from Kindaruma is asking, Dr. Musheru, why is it that most psychiatrist doctors don't believe in demon possession and end up giving wrong diagnosis? I don't know whether demon possession, I don't know whether that's part of your field.
Okay, I would say this. Demon possession is not scientific. Research has been done, and it has been going on, and it is still going on with most organizations. And it has been found that most mental illnesses are associated with biochemical imbalance in the brain, not demon possession. So, ideally, when somebody comes to us, we do not just, it's not as one size fits all. You just don't give medication blindly. We investigate the patient, so we take them through lab tests to rule out any medical causes of the same. And even CT scan of the brain and MRI. By CT scan, I'm talking about computerized tomography. It's a more superior investigation than an X-ray. MRI is magnetic resonance imaging. It's more superior, but we are trying to look for, is there a growth that could explain why you're behaving abnormally? So we just don't give medication blindly. We have to try and look for to rule out a medical cause before we then say it is biochemical imbalance that is causing the symptoms, and therefore prescribe medication. So for the viewer, I would like to clarify that demon possession is not scientific. There are no studies that have shown demon possession can cause mental illness. It's only, like, I would say, a cultural explanation of what we don't understand.
Now, people with mental illnesses tend to be violent. Sometimes they go naked because they have they're not on this earth. At one time, it used to be that if you could not go to where you work, your workstation at Mathare Mental Hospital, they had to call the police and they say you have hit somebody so that you can be admitted there. I suppose now the situation is different. Can you tell us how different it is and how different in other countries of the world?
Okay. In Kenya, we are a step ahead, unlike our neighbors in Tanzania, in Namibia, where you have to get a court order from a magistrate to take any patient to a mental institution. Here, you just walk in like you would walk into any other hospital, like Mata Hospital, Nairobi Hospital, Aga Khan, or any other hospital, or any other public hospital. And when you walk in, the Mental Health Act has provided for 4 modes of admission. You can bring yourself to Mathare Hospital and fill a form requesting for voluntary admission. You can bring a relative or a friend to Mathare Hospital and apply for involuntary admission. The police can bring a person who has been in their custody for less than 24 hours for emergency admission. And a police officer from the rank of an inspector can recommend emergency admission for the patient. The 4th one is for foreigners. Foreigners have to go through their embassy. The embassy applies for admission through what is called the Kenya Mental Health Board. Then the Kenya Mental Health Board will allow for example, Mathari Hospital, to admit a foreigner into the hospital. But there are checks in place such that you just do not bring your enemy to Mathari Hospital and have them admitted and spoil their reputation, for example, their political ambition. The doctor must also recommend. So it's not just a one-way traffic. There has to be recommendation by the doctor that you actually do need the treatment. So if you don't have food and you decide to come to Mathari Hospital to admit yourself for the night, it won't work for you, because the doctor has to get an indication why you're getting admitted. So what we are trying to say is the Mental Health Act protects the public such that admission to mental institutions is not abused. And also their treatment, even out there by insurance companies, by the medical professionals, is something that is controlled.
Why is it that there are not many government mental hospitals?
Every district hospital, county hospital is a mental health hospital in terms of you can get admitted to any hospital from, for example, from the sub-county hospital, county hospitals, the tertiary hospitals like Mathari Hospital. They are all mental hospitals. They are gazetted as mental hospitals. So we wouldn't say that Mathari Hospital and Gilgil are the only mental hospitals that we have in this country. Any other county, sub-county hospital has been gazetted by the government as a mental health, as a mental hospital.
The doctors are not there. The facilitators are not there. The doctors are not there.
We are trying to train as many psychiatrists as possible. Like, for example, now in the first year, we have already 24 who have joined. In the past, you would have maybe one person, maximum of 6 people per class. But we are gaining some popularity, and we are hoping that with time we will have psychiatrists in the entire country, distributed in the entire country, so that we are able to serve our population of 41.6 million effectively.
What is happening at Moi Teaching and Referral Hospital in terms of this commemoration?
We are trying to, we have an event, there is a procession. After the procession, there is a tour at the new facility. They have a new mental health unit which has been renovated, and there'll be a tour for those who are attending the function around the mental health unit, after which there will be entertainment, there will be speeches, and there will be public awareness over print or electronic media to enlighten the public about mental health and dignity in mental health. I would like to clarify that by mental health, we don't mean the illness. Good mental health is something that we want for us all. What does it mean? Good mental health has 3 arms. 1, I need to be able to love myself. And for you, you need to be able to love others. You also need to be able to form lasting relationships and trust others. That's the 2nd arm. Then the 3rd one is you're supposed to be able to meet life's demands and work productively in your community.
Which you cannot do when you are not mentally proper.
Yes, when you're not mentally well, for sure, you will not be able to do that.
Somebody is thanking you. Thank you, doctor. You treated me. Now I'm very well. But it does not say who he or she is. It says God bless. There are some people who are being haunted and even talking to the dead. Do you regard this as a mental problem, or does it require only prayers, according to Joe Dido of Lucky Summer?
For us to make a diagnosis, we would need to see the client, would need to take a history, examine the client, and also send them for investigations to rule out any other issues that they may have in addition to talking to the dead. Then it's important to find out whether they have maybe lost somebody, they are still having abnormal grief, so maybe they did not mourn over the person, and it would be important for us to see the person, for us to make the diagnosis and know the way forward. I wouldn't really recommend that you go for prayers at the moment. I would recommend that the person is first evaluated, and then after evaluation, we can decide whether the person needs medication or needs grief therapy. Grief therapy is just going to a psychologist and being taken through the grief process. Then about the prayers, it works in terms of having social support with you. So once you have recovered, it is important to join your other countrymen or your fellow countrymen in worship, in women's groups. I mean, it is part of social support, or I mean, it's part of the social support, I would say. But I wouldn't recommend that you directly go for prayers when surely you're dysfunctional. Because what is coming out here is that this person has stopped functioning. They're not able to relate with people well, so they're socially dysfunctional. Maybe they're not even going to work. They're busy talking to the dead.
Anyway, it looks like you're going to opening a clinic here for people to ask questions about their personal problems. I'm 33 years married, and as friend, so as a first with so many problems. Whenever I'm stressed, I eat a lot of sugar. Uncontrollably, I eat sugar. I've only 13 teeth left because of the sugar business. Is that a mental health? Another one saying, my wife gave birth 3 weeks ago and lost, last Tuesday, the baby choked while suckling, prompting the mother to be so scared. Since then she has been trembling and very fearful. John says, please help.
Okay, for both those viewers, I would recommend that they go to the nearest health facility for evaluation. If the doctor on the ground then feels they need further assessment by a psychiatrist, they will be referred. Then for the last one, especially the fact that the baby choked and they are now trembling, one, they would need evaluation, as I said, and they'll need a lot of they'll need a lot of support, especially from a psychologist, because this is a traumatic thing and you need to deal with it. And the trembling may be probably because the person now is very anxious and will need treatment. So I would say that they need evaluation, after which then we can plan the treatment.
Tell us about recovery of mental illnesses, because the attitude of the public is that once you go to Mathare, you're done. The recovery, what is the recovery? So that when somebody comes from Mathare, so that you can end the trauma, that when somebody go to Mathare, I can trust them. That, you know, if for instance one has hit and they recover, when you, or one, any other illness, you will integrate appropriately with the members of public. Is that the case with mental illnesses?
Yes. What happens is, once you're treated effectively, you're able to function socially and occupationally. Depending on the illness, you may need long-term treatment or follow-up, for that matter. So it will be, if there is no one-size-fits-all to say that once you're treated for a week, everybody will be well. It depends on the client. But people do function socially and occupationally. They go back to their families, they go back to work, and mental illness is not something permanent. Unlike, for example, intellectual disability or mental retardation, where it's a developmental disorder, there's nothing you can do about it. In terms of, you cannot change the fact that that person has that developmental disorder. The only thing you can do is to support them, learn how to do activities of daily living, like showering, like cooking, and getting around their daily business. But for mental illness, like for example anxiety, it's a common mental illness. It is something that, it is a condition that you find in maybe 4 out of 10 people queuing in a general hospital. It is something you can be treated for and you go back to normal functioning. But should you not be treated, you can get very dysfunctional. And like for example, if depression is not treated in time, it can result in suicide. So what we are trying to say is that if mental illness is diagnosed promptly, treatment is sought early enough, and the person continues with follow-up, they can function like any other member of the society.
What is depression and what is stress?
Depression is a mood disorder. It has to do with very, very low moods. You feel very sad. You also feel disinterested in daily activities. You don't feel like doing anything. You don't derive pleasure in doing anything. You feel hopeless. You feel helpless. You're not able to make decisions. You may feel suicidal. You feel life has no meaning. Sometimes it is you lack energy such that even getting out of bed is a problem. Your appetite may go down or up, so you might find yourself overeating. So that is called sometimes comfort eating. So you might decide to nibble sugar, probably, or nibble anything else. Just eat to comfort yourself. And you may have problems with sleeping.
Yeah.
Also, you might find yourself abusing alcohol because you're so low. When you take a little bit of alcohol, you feel a bit excited. Then once you feel a bit excited, then now you feel, oh, my symptoms are gone. But it's only temporary relief. But depression is something we can treat. It is very common, 4 out of 10 in patients queuing in outpatient settings. And it is something that we can treat.
Somebody is looking for your contact, Veronica Kanyanjui from Kangemi. They can come to Kenyatta Hospital. I mean to Mathare Hospital.
Yes, please.
You don't want to give you a phone number.
That's okay.
What causes conversions when there is no family history?
Convulsions are of 2 types. There are convulsions, what we refer to as kifafa.
Yes.
Epilepsy is the English word now for kifafa. And
is that a mental
epilepsy,
illness? Is that a mental illness also?
they do come to us. Okay, it's a brain disorder, but they do come to us with abnormal behavior, with psychosis, that is loss of touch with reality. Now, the 2 different types of seizures or fits are, one, if you have epilepsy, you have 2 or more unprovoked seizures. So you can't explain why. They just happen on their own. That is epilepsy.
You drive and then you all of a sudden you
Yes.
can't control your steering wheel.
Exactly.
Yeah.
That is epilepsy. No, you can't find any cause. It is just unprovoked. Then we have what are called psychogenic non-epileptic seizures. These are the ones that could happen because you have stress. So as opposed to the one that you can't find the cause, this other one is associated with stress. And the one that is psychogenic usually happens when there are people around you. It hardly happens at night. And it lasts for minutes to hours. It lasts for a long time. If I'm to talk about epilepsy, the seizure will only last probably 30 seconds, or maximum between 30 seconds and 2 minutes. After that, the person either goes into prolonged sleep or may pass urine on themselves, and that's the difference. So psychogenic lasts longer, has a specific stressor associated with it, only occurs when there are people around, and it's not something that probably you would say you don't know the cause. From history, you will be able to identify an association, and it can be treated both with medication and talk therapy.
Somebody here says, hey, this is very unfortunate. I have worked in Mathare Hospital and I'm seriously stigmatized, even by my husband, for having worked there.
I have worked in Mathare Hospital. This is my 12th year. I'm not stigmatized. I would say that, okay, people may have given me a label, Mathare doctor or something, I don't know.
Yeah.
Or they say those patients belong to Moshe. I mean, they are her patients. They're not anybody else's patients. But I would say maybe it would be important that people get to know what we do. Then if they know what we do, they'll stop stigmatizing us. But if it is really affecting the person, then I think we would need to talk to them so that they talk to us and we see how we can help.
You see, the sad thing is this is a person who has worked there.
Yes.
Maybe not even a doctor, but just working there.
Yeah.
And she's stigmatized. What about the person who has come there as a patient? How do you tell society, please accept them?
We have done this. We have integrated other services together with mental health services in Mathari Hospital. So you find there is a diabetic clinic, there is a dental clinic, there is CCC I mean comprehensive care clinic for HIV patients. There is methadone clinic for people who are suffering from addiction to heroin. So we have tried as much as possible, even MCH, Maternal Child Health Clinic and Family Planning. The people in the catchment area come there. So when you walk around the institution, it's not just people who are mentally ill who are walking around the compound. It's the general public. So that is helping to destigmatize the institution, such that if you're seen walking through the gates of Mathari Hospital, it doesn't mean you have a mental problem.
Yeah.
No. You could be coming for any other problem. We also have a lab, we have X-ray, we have ultrasound services, so you may physiotherapy services. So you find people, the public, coming for physiotherapy there. They have no mental illness, but they're coming for physiotherapy. So with the integration of the services, we hope to destigmatize the place. Also, by me showing up here, by we people being on print media, we are trying to demystify what people don't know about mental illness. Let them ask us. We are here to answer any day. We are here to answer your questions so that we stop being associated with demon possession, witchcraft. I mean, people don't quite know what you do. So once you enter those gates, oh my God, you're condemned. No, we don't want that. So as much as possible, we want the public to have an inquisitive kind of look, find out as much as possible about mental illness, come to Mathari Hospital, visit us. We like visitors. We are looking for friends who can assist with making the place look different, making our patients look different, and also appreciating those who have been with us as friends.
Thank you very much, Dr. You have heard that mental health is like any other ailment. Mental health is being able to be healthy in your head so that you can perform your daily chores. If you go to Mathari, it doesn't mean you are mad, not at all. And when they come out, they are normal people. Let's go now to get some music.